I never ever thought there'd be something out there. When I said to my kids, they were totally unbelieving when I said, we're going to be going to GP surgery. And they were like, you're going to go and train a GP?
So the De-Stress project began in 2016, and we were interested in understanding the impacts of austerity and welfare reform on mental health in low-income communities. And what we found was that there was a huge amount of antidepressant prescribing for people from low-income backgrounds. We found that GPs themselves were quite frustrated that they weren't able to offer other alternatives to their patients. This latest part of the project, De-Stress 2, began in 2021, and what we wanted to do there was take our learning from the first project to develop a training resource where we could work with community partners and health professionals to develop a training resource that could be used by all types of primary care practitioners.
What we wanted to do in De-Stress 2 was work out how best to deliver the messages of that training to diverse practices across the country. We had community partners working alongside GPs to actually deliver these sessions. So they were involved in planning the actual content of the session and delivering it to GP practices as well.
I thought, whoa, this sounds like something I could do because I can give back. You know, I've got lived experience, so I thought that my lived experience could help another person or persons. So that's one of the main reasons why I decided to take on the project.
And my part in the De-Stress project is just part of a team, shall we say, and putting my contribution with my life experiences and sharing them. I can only see that as a positive thing.
In the very beginning, we were expected to go out there and give our heart over to these GP surgeries, you know, and what was going to happen with that, you know, with that information, you know, and that was a fear factor. There was a lot of fear going on, for me anyway, when we first started.
For me, it was a wonderful opportunity where I took all these questions and this feedback to the GPs and to discuss them that what kind of support a migrant population member needs.
We had peer-to-peer community partner drop-in sessions. They were arranged by poll who could make what times, and we kind of set on two times a week. They've been a support, so a support structure, a sounding board, a way to practice and rehearse for the project, to get to know each other, to overcome the fears and anxieties we all have, probably a little imposter syndrome as well.
For me, it's helped me get through being able to go and deliver into GP surgery. It's helped knowing with my confidence, just being able to share with everybody, feel the support from everybody, hear the stories of how it's gone. So it's just been the best thing for me to be part of this, and the drop-ins have helped get me through this, being part of the project.
They have given us the confidence, the encouragement to co-deliver the training. We got the ideas for questions to ask GP practices, to nudge discussions. So I think the drop-in sessions been a great help, and we would not have be able to deliver these sessions without these.
I think because it was such a non-hierarchical team where even the senior members would join our community partner forums. They're very humble, very accommodating.
We started to build that rapport, the trust, and all that kind of thing, and then this group became what it is today. Because without the group, I wouldn't have done the delivery, I'm sorry to say. I really wouldn't have done. I don't think I could have done it. Not that I wouldn't want to do it. It's a case of I don't think I was able to do it. I was very scared. And I think after the first presenting, looking back on it, it was the best thing I ever done.
I think the community partners help keep the project grounded and relevant. They help ensure that the project has impact that matters, not just academic journals, not just conference papers, but actually real on-the-ground impact that is actually going to have an impact on people's lives. You have to have community partners within a project like this. Otherwise, you're doing to people rather than working with people. This is health inequalities research. Of course, you have to have community partners at the centre of that. It wouldn't work otherwise.
I think by me being so honest and open about my struggles and the nervousness that I was feeling about going into the GP surgeries, I think by me naming it and saying I'm terrified, I don't think I could do it, I think it helped other community partners to be able to say, yeah, we're struggling a little bit too. So yeah, I think I just think my empathy and just not covering up the way I was feeling and being so scared.
So because I was trained in mental health peer support, I think I helped strengthen and embed the ethos of peer support work, and that we were there as peers and equals, not just those with lived experience, but also researchers and other people on the project. I brought some sort of courage to share my vulnerability and just be real.
I feel really, really privileged, and I use the word privilege because I never use that word for anything, but I tell so many people I work on a research project for Exeter Uni. I don't say it to brag, but I'm really proud because it's way out of my league. In the year and a half that I've been on the project, I've managed to plan for the future. I am volunteering now with another mental health organisation. I have spoken at a few conferences. I'm actively working, doing more and feeling good, that I feel now that I have something to offer, even though it's only through my lived experience. But I'm learning now that everything I went through wasn't for nothing.
My life changed because I was able to talk in a group, in a mass and everything else at work, and also at other different venues for different charities and stuff like that, which I was volunteering for at that particular time. And I was able to start talking to people, and now I'm teaching people. I mean, I can't believe I said that, and that was a year ago.
I think this De-Stress project has given me confidence, and it's given me chance to raise awareness about this project, and specifically speaking about it to my community. So thus I feel I'm so happy that I've been a part of this De-Stress project.
I gained confidence, community. I felt more congruent in my values and what I was doing again. I had connection. Yeah, it did me a lot of good. It did my understanding a lot of good, and it also gave me a platform to apply my skill sets and knowledge.
With us as a group, we are strong, but also I think it'd be great to have a way to recruit new members as well. So not just have a group for ourselves, but also as a group where people can, come and talk to us and share ideas and all that stuff, and also probably talking about the future with university, doing some kind of more case studies and stuff. It will be really good for the university then to tap into this group, to use this group to do some kind of research.
And I think we've got a lot to give and to offer, and I think we really work well as a team. I think we've all got our strengths and what we're good at talking about and sharing, and it would be great to be able to do some work together in the future.
The autonomous group was also about uniting sort of grassroots people and their motivations. So it wasn't just about community partners in my mind, it was about the humble and brilliant academics we've worked with and researchers that were really serious about grassroots.
I can only say that the De-Stress project, I wish all projects were like this, but it has been a different type of setup. Obviously, we're very lucky that we can speak to one another online, and let's see where we go from here.